All right, take two, second part of my conversation with adult leaders. So one of the people we're talking to is his NER doctor, and I was asking him about some of the things he deals with on the regular basis. He had some great opinions about things, but he sees people constantly coming to the ER for different things. And a lot of people he sees, 80% of them are probably on Medicaid and don't have to pay a dime to be there. And so they're utilizing and they're using resources of the ER when in reality, they probably should not be in the ER and using those services in the first place. There's other things they could be doing. Give an example of even somebody coming in to use the ER to get a sandwich because they were so hungry. They were living on the streets and things like that. And they gave them a place to sit. Basically, they gave them a $500 sandwich or $1,000 sandwich because the state had to pay that bill. There's so much more waste and abuse in that system that just should not be happening. Like, there are better places sending our money, especially for Medicaid, not for ER visits, when people should be using other services and maybe something a little bit more affordable, especially when it comes to Medicaid. My question was thinking about, well, how do we make it so they don't think of the ER first? And it kind of opens up a lot of thought process on my end of how to make things a little bit better. Our Medicaid system is really kind of screwed up because it's the one system where everybody gets basically free healthcare no matter what. They don't pay any copays or like that. And it's a really difficult transition when somebody actually loses their Medicaid and goes on the ACA or employer coverages, because now they go from paying nothing, they don't actually have to pay copays and things like that. It could be a big shocker. So how do we fix that system and make it so maybe Medicaid can be a little bit more efficient and work better? In reality, I think that could actually be solved if we just took everybody off Medicaid and switched to the Medicaid system and brought those dollars really into the ACA. Made it so all those people can get a plan and get those cost share reductions that we normally get on the ACA for low income. What that means is they still have some health insurance. They get choice of insurance, which is nice. And if their income goes up, they don't get kicked off the plan. They just update their income and they have to pay back some of their tax credits. So that would be ideally a situation. Also, when you have a little bit of a CSR on that Medicaid level, you still have some copays for things. You have some skin in the game. Go to the ER, it's going to cost you a few $100 to go to the ER. The insurance companies are going to incentivize you to use your health care in a way that's a little bit more appropriate. It's like, hey, we give you free access to telemedicine and mental health services via your phone or apps or things like that, which would be a lot better for these people than having to deal with the welfare system. I think we can make it also welfare more efficient instead of having to deal with all these medical insurances. They can be, welfare could provide things like food and housing and be more efficient than having to try to also not only do food and housing, but also do medical and things like that. It can focus its into actual needs and keeping people healthy and making sure that they're taking care of the things they need. And then the healthcare stuff they can deal with regards to the insurance companies, and those dollars can go that place. That would make a lot more sense. Getting the employer coverage would be another whole other market, but it would help make it so everybody's in the same pool and competing and things like that. Also, that we're not tied to that employer and who they're picking for their insurance company. You have that choice. That'd be amazing if that can happen. It can also be easier as you transition to Medicare as well. We can use those dollars to help offset some of the costs. I get a lot of people that actually, a lot of times they're on the ACA marketplace because their income's pretty low, pre-retiree, and all of a sudden go on Medicare, and their Medicare costs actually go up, which is so annoying and frustrating for those people because it's like they could barely afford health insurance as it is, and now they gotta go on Medicare and pay a lot more for their health insurance. And sometimes the plan coverage is actually not much better, surprising enough. But it's tough, that transition that happens. So maybe we can have a system that works better all their lives as opposed to these different pools and things like that. Maybe start with Medicaid reform first. That system that's meant for the poor people and stuff like that. Make it so, yes, they can probably get free health insurance, but give them some skin in the game. Give them some choices, especially on the ACA. Have them go shop in the marketplaces and say, you know what, you get a full tax credit to buy this second cheapest silver plan. You can still buy that plan. You have the dollars to do that. You can pay a little extra, buy maybe a better plan if you wanted to. You got to go within that network, but when you go to the ER, you got to pay a few dollars. When you go see a doctor, you got to pay a few dollars. Not all of it, or you'll pay 6% of it maybe, which isn't very much, but you got some skin in there to help maybe make some better decisions. Maybe you'll think twice about smoking those cigarettes and making it so you're really unhealthy. Maybe you'll try to get some better medications that'll help take care of those those chronic conditions you have, because you're willing to go in and make some, maybe you have to pay for some of it, so you got to do some work. It's just a great way mentally. That goes along with everything I've been talking about, I think, this whole conversation. So how do we do that? That's going to be something Congress has to do with regards to keeping the Medicaid system going. I don't know how to do it. Maybe you guys do.